I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to go over do hamstrings cause low back pain? So I have kind of a friend tonight. So this is our skeleton model, brought out just to see a little bit easier where attachments are and why we're going over this topic. So today seems to be a popular day for a lot of low back pain because of the weather being nice over the weekend and a lot of people out gardening, fixing up the yard, kind of taking advantage of maybe one more nice weekend before we get to winter. So we had a lot of issues with low back pain, what's in what you were being treated for, a lot of questions on it. So here we go. We're going to go over this. And one of the big contributors to back pain are tight hamstrings. And a lot of people say, oh, it's hereditary, I'm not flexible, blah, blah, blah. So unfortunately, that's not really an excuse, and it's not one that you can use in order to get out of stretching your hamstrings or foam rolling your hamstrings, because it is imperative if you have low back pain and you have tight hamstrings, there's no way to actually loosen up your low back without actually loosening up your hamstrings. So if you just want to blow off the hamstrings and just say, oh, they're tight, my dad's hamstrings are tight, mine's tight, they're just not going to loosen up, and you suffer from low back pain, even if it's stiffness, soreness, then that's an issue, and you really need to address it. So here's your spine. All right, so this is the front of the spine. This is the back of the spine. So all of these are the little bumps that you feel on your back, okay? So then here is your tailbone right here, and then these are your hips. So what happens is the hamstrings are going to come up and they're going to attach up here. And they're going to attach at the bottom of your hip bones. The low back muscles all are going to come up and attach here. All right, and we're not going to get into specifics right now. We don't have that much time in terms of where exactly the attachments are, all the different muscles that come up and attach here. But basically, this is where the back muscles attach, and this is where your hamstrings attach. So as you can see, if your hamstrings are tight, and what happens is when you have a tight muscle, it shortens. So it's going to shorten and it's going to pull. So this is going to cause that low back to go into a curved position, or depending on which way you're tilted, it's going to cause those muscles in the low back to be affected. So if your hamstrings are tight and they're pulling, now all of a sudden the low back muscles have gotten pulled. All right, so you're literally, if you've got these tight hamstrings, you're going to be pulling down, your legs are going to be pulling down, and then your low back muscles are going to be stretched. And you're like, oh, stretching is a good thing. Not in this sense. So you're actually causing strain to your low back as your hamstrings are tight. And a lot of times the problem is that one hamstring is tighter than the other hamstring, so now you have this side pulling a little bit more, this side pulling a little bit less, so you can get rotation in your pelvis, which sometimes can cause that pain, like right there, when somebody's not the pain in your butt. And a lot of times people walk in and be like, I have a pain right here. That can be caused from tight hamstrings. That can be caused from a pelvic rotation, which can be caused from tight hamstrings. So this pelvis, although it's bone, it still does move. So having these muscles come up and attach here and attach at the bottom and not working together causes issues, causes problems. So when you have these tight hamstrings sitting down here like this, and then you have your low back muscles, what's going to happen is these pull, these are going to try and hold on, and they're going to try and grab your pelvis and pull it this way. So now you have like this tug of war going on, which is where you get the pain, because your muscles are going to be strained. They don't want to work this hard. They shouldn't work this hard. So can tight hamstrings cause low back pain? Absolutely. So what should you do? How do you know if you have tight hamstrings? How do you know what you should be doing for those tight hamstrings? So most people know if they have tight hamstrings. If you don't, you can just try and prop your leg up on a table. Can you prop your leg up on a table? Most people can't do that, and they're really tight and they'll be down here. Some people will try and do this and actually pull a hamstring. So you want to check the length of your hamstring. Now my hamstrings are actually pretty tight. I can put that up on this table. It gets my leg to almost 90 degrees, but that's about it. So if I stand up nice and straight and I try and lean forward, I don't go much further because I start to get a pull and I start to get a pain. So What I need to do is I need to foam roll right now, which is one of the videos that you can watch on our YouTube channel on how to foam roll the hamstrings. That's the first step in loosening up your hamstrings. And a lot of times it's painful, and I know that there's a lot of foam rollers out there collecting dust because of the fact that it can be very painful, but that's the first step in helping to loosen up that hamstring. The second thing is you can do your hamstring stretch. So what you actually want to do is when you're doing a hamstring stretch, you can do it like this. And there's nothing really wrong with this. The thing that you want to make sure of is a lot of time when hamstring stretch, I see this. So it looks like I have totally fine hamstrings so that I can grab my toe, I'm totally fine. But all I'm doing is actually stretching my low back. I'm not really stretching my hamstring. I feel it a little bit in my hamstring because my leg is up on a table. But what you want to do is you want to find a doorway and actually lay on your back and then prop your leg up against the doorway. Okay, so that way you're laying on your back and then your leg is propped up against the doorway. That's going to allow your back to stay flat. So none of the stretch that you will get will be in your back. It's all going to be in your hamstring. You may get some numbness, you may get some tingling, you may get some sharp shooting pain. Any of those things discontinue the stretch. Usually means there's some nerve involvement that you do want to get checked out, so don't continue to do that. And then the other thing that you can do is just to start loosening up at your hip is our figure 4 stretch. Now we've done this a couple times. You can do the sitting, you can do the standing, you can do it laying down. Not going to help loosen up the hamstring, so to speak, but is going to help loosen up a lot of the muscles that are surrounding that low back area. Also, super important with low back pain is not to stay in one position for a long time. So you want to make sure that if you have tightness in your low back, you have tightness in your hamstring, you want to get up every 15 minutes. I don't care if you're sitting, laying down, whatever, you want to get up. And it doesn't have to be like a 5-minute break, but just stand up. What's going to happen is it's going to allow some blood to rush into those muscles and allow those muscles to actually relax a little bit. As you sit for long periods of time, your back will tighten up because there's no real blood going to the muscle. And that's why working out or walking a lot of times will help alleviate back pain because of the fact that it's actually allowing some fresh blood into the area. So it's really important that when you have either tight hamstrings or you have either a stiff low back pain, and I hear all the time, well, I wouldn't really classify it as pain. Okay, call it stiffness, call it soreness, call it pain, but whatever label on it you want. When you feel that, you want to make sure you're getting up every 15 minutes at least. You shouldn't stay in any one position for that long. You're going to start to affect the low back, which then is going to affect the upper back, which then is going to affect the neck. A lot of patients come in and say, everything hurts. I just got to get a whole new right side. I don't understand. It's because everything's connected. So I understand it, So when you're in that type of situation or you have that low back pain, stiffness, soreness, or maybe your whole right side's affected, make sure you're getting up every 15 minutes. It's really, really important to have those muscles continuously active, continuously moving to help reduce some of the pain. If you are experiencing low back pain or tight hamstrings, you want a doctor of physical therapy to take a look at it. We offer free consultations. All you have to do is call our office at 215-997-9898, and we'd be happy to set you up. Thank you and have a good night.